Despite the rapid advancement of modern medicine, the enduring presence of traditional healing continues to shape how many people understand illness and seek treatment. This raises an important question: why do these practices remain strongly believed and practiced today? Good day, everyone. We are from BSN 3E Group 3A. I am GENEEN, and together with me are my groupmates, DOWEN GARCIA, ZYBYL IMJADA, CYRILLE LABIGA, LAMIG, and RAMZEL. Our study, HERBOLARIO and HILOT, exploring the enduring belief in traditional healing practices among community residents.
This study aimed to explore the enduring belief in HILOT and herbolario among selected community residents. Specifically, it was focused on the personal, cultural, and socioeconomic factors, particularly the health-seeking and health-seeking behaviors that are rooted in the continued practice of these traditional healing methods.
This study used a qualitative descriptive design to explore enduring beliefs and practices of herbolario and HILOT. It utilized in-depth interviews using a research-made interview guide consisting of consent form, the demographic profile of the participants, and guide questions on personal, cultural, and socioeconomic influences on HILOT and herbolario practices.
5 core themes emerged from the study, highlighting the balance between ancestral beliefs and the practical realities of modern healthcare for community residents. Theme 1. HILOT and LOUISE. LOUISE as a primary and accessible healthcare. HILOT and LOUISE serve as a readily available and trusted first-line healthcare options in the community due to their accessibility, affordability, and cultural familiarity. Sub-theme 1A. Intergenerational transmission of traditional healing practices. Traditional healing practices are sustained across generations through familial teaching and shared experiences, reinforcing their continued relevance in the community health practices. The participants stated, yes, LOUISE and HILOT because LOUISE and HILOT come from our ancestors and passed down as tradition. Sub-theme 1B. Symptom-driven utilization of traditional healing. The use of traditional healing is primarily guided by the presence and type of symptoms, with individuals selecting specific practices based on their perceived effectiveness for particular conditions. The participants stated, if there's tuyaw that doesn't go away in 1 or 2 days, based on my experience, if the child undergoes tawas, they will recover and the illness disappears. When I feel unwell, I don't go far or look elsewhere. I just stay with our local healers.
For Theme 2, Culturally Defined and Symptom-Based Health Concerns in Traditional Healing. Health-seeking behavior is dictated by cultural framework that categorizes illness based on specific symptoms recognized by the community. Subtheme 2A, Culturally Bound Condition and Medical Illnesses. Participants distinguish between illnesses that require biomedical intervention and those perceived as spiritual or cultural affliction requiring traditional remedies. The participant states, I believe it when they say that my child has tuyaw, because if there is no traditional intervention, his fever does not subside. For subtheme 2B, Reliance on Traditional Assessment Science. Community members place high trust in non-biomedical diagnostic techniques such as pulse reading to identify and validate their health concerns. The participant states pulse reading because they say if the child's pulse is fast, then there is kibit, and when there is kibit, the child should be massaged.
So for our next theme, we have the physical, economic, and psychosocial benefits of traditional healing. Traditional medicine provides a holistic advantage by addressing the physical, financial, and emotional needs of the patients. So for subtheme A, we have the economic and practical benefits. So the affordability and lack of bureaucratic processes make traditional healing a highly practical alternative for families with limited financial resources. So as stated by our participants, it is cheap, near, and it's not like it takes a long time. We have to get admitted and process all sorts of things. So for subtheme 3B, the relief and the power of belief, so the efficacy of traditional healing is significantly bolstered by the patient's faith in the immediate psychosocial comfort provided by the healer. So as stated, if you believe in miracles, they are really there. If you believe, you will truly get well.
Theme 4. Diverse outcomes and experiences in traditional healing. While generally valued, traditional healing is subject to critical evaluation based on its clinical effectiveness and the safety of the experience. Subtheme 4A. Adaptive health-seeking behavior. Community members exhibit clinical discernment by recognizing the limitations of traditional methods and transitioning to professional medical care when necessary. A participant stated, if my cough lasts long and can't be cured by ginger, I really go to a doctor. If my arm gets fractured, I go straight to a doctor. Subtheme 4B, negative experiences and pain. Adverse physical outcomes and traumatic encounters serve as critical deterrents that shape and sometimes limit the continued use of traditional healers.
For Theme 5, Preservation and Continuity of Tradition. The future of traditional healing relies on selective process where beneficial practices are maintained while those conflicting with modern values are discarded. In Subtheme A, Keeping the Helpful and Rejecting the Bad, participants exercise agency by filtering traditional practices through their personal or religious beliefs, accepting only those they deem safe and morally sound. Participants verbalize, I can probably accept HILOT, but what they call herbolario, I will not accept it because of the consequences. It belongs to the demon. For Subtheme B, Impact of Formal Education and Family Tradition. The survival of traditional healing is a dynamic negotiation between the deep-seated influence of family upbringing and the corrective impact of formal scientific education. Participant states, yes, because whatever you learn from the elders, you should apply it to your children and grandchildren.
The study found that traditional healing practices such as HILOT, herbal remedies, and culturally rooted treatments remain widely valued among community residents in Northern Negros Occidental due to their accessibility, affordability, and strong cultural significance. Family members, particularly elders, played a major role in preserving and passing down these practices across generations. Participants commonly used traditional healing for minor illnesses and discomforts, while modern healthcare was sought for more serious or persistent conditions, showing a balanced and practical approach to health-seeking behaviors. These findings highlight the continuing influence of culture and family support in shaping healthcare practices within Filipino communities.
We recommend that the following sectors utilize the findings of this study: the Department of Health officials, university administrators, nursing educators, clinical instructors, community residents, nursing students, and future researchers.